Hi, I'm Babette Edgar, and I'm here today with Ken Schaecher. Ken, where do you work?
I am Medical Director for Select Health, which is the HMO for Intermountain Healthcare in Salt Lake City, Utah. And I've been a member of AMCP since 2004.
Well, that's great. What we'd like to do today is talk a little bit about the future of managed care, and I'd like to ask you a couple questions. So if we're thinking about digital applications and devices, how do you see these applications being used in managed care both now and in the future for and between business relationships?
Well, I think digital applications are the wave of the future in many ways. I think we have to be aware of that. Healthcare has transformed over the last 5 to 10 years. Where we used to, as a health plan, provide services for case management, for managed care pharmacy, that were primarily paper-based. It then became email-based. And now digital media such as texting, email, and other device-based services are becoming the essence in a society that is increasingly mobile and increasingly relying on their digital devices. I think also digital devices will allow us to perhaps better manage patients through reminders, adherence programs, also even perhaps monitoring their vital signs. We now have iPads and iPods and iPhones that can all do blood sugar monitoring. And that can be transmitted electronically to a case manager or a pharmacist to help manage their disease. So I think it's the future of where healthcare is going, and I think managed care and AMCP will be at the forefront of finding those applications and finding ways to apply them.
Great. Have you seen pharmaceutical manufacturers getting involved at all with the digital technology?
Oh, certainly. I think as much as anything else, the various pharmaceutical manufacturers, as they bring forward new products, and even for their existing products, are trying to use digital media as a way to engage health plans, to add value-added services, to help bring greater value to the products that they are bringing to managed care organizations.
And how about within your own organization? Have you thought very much at all about using this type of technology with your own patients?
There's a lot of discussion around it and not always a lot of action. I think we're judicious as an organization. We tend to build rather than buy. And I think what we're trying to identify is in our geography and in our demographic, which media tend to resonate best with our membership. To this point, we've used digital media very limited fashion. Again, we assess them as they come, and I see us moving in that direction over time, particularly with the Affordable Care Act, the changes that it's going to bring with regards to an insured population that's going to greatly expand, and yet not have access to adequate health care due to a lack of providers. So digital media will help augment that and perhaps help us be able to better manage these patients.
Okay, great. So I'm going to switch gears just a little bit here. You're a physician, correct?
Yes.
Okay, so the Academy of Managed Care Pharmacy started off with a group of pharmacists. And as you probably know, the bylaws are changing this year to give non-pharmacists more privileges within the AMCP organization, such as voting. Since you aren't a pharmacist, could you give us a little bit of your perspective on how you see these changes affecting managed care pharmacy, and why did you decide to join as a non-pharmacist?
Well, again, as I said when we first talked, I first became a member in 2004. That was long before these changes were made. I see the value of the Academy in bringing forward the principles of managed care pharmacy. And though the pharmacists who had the vision to form this group out of another entity were pharmacists, they also had the vision to know that it was about managing pharmacy services in a managed care environment and not who did it. So I really take my hats off to the leadership of AMCP who continued that vision, because pharmacy services are not just going to be provided by pharmacists. This is a team, just like the patient-centered medical home and accountable care organizations. Other entities now exist that promote team management. I think having physicians, nurses, nurse care managers who are on equal footing with the pharmacists within the organization can do nothing but strengthen it and help it grow so it truly represents the organization that speaks for managed care pharmacy in the country.
Okay. And do you see, how do you see managed care progressing? You know, you talked a little bit about patient-centered medical homes and accountable care organizations. How do you see these managed care principles being used in the different populations such as Medicare and Medicaid, the employer-sponsored benefits, in the exchanges? Do you see different things happening in the future?
Oh, I think it's going to continue to evolve. The Affordable Care Act of 2010 has put in place changes that are going to require managed care organizations to step up and do things differently. And I think it even more so, we're going to be focusing on outcomes instead of the quantity of services provided. We're going to ask for more of our providers, and because of that, I think AMCP and managed care pharmacy in general is positioned to lead that. Most of the cost of healthcare, 80% of the cost of healthcare, comes from 20% of patients. That 20% of patients needs to be engaged. They need to be engaged around their healthcare. And many of these patients have 4 or more chronic diseases. Those patients are being treated with medications for the most part. If you can't find ways to manage their pharmaceutical needs and come up with solutions that meet their needs to improve their adherence, improve their compliance, you're not going to achieve the triple aim that we all want, which is affordable health care, the right health care, and an improved quality of life. So managed pharmacy services are just going to grow. I also think MTM, that is required with Medicare, and other similar services have also caused a change in the perspective of the pharmacist as part of the team. They're no longer that person who passes out pills or comes up with a formulary. They're more than that. They're a clinician who can add to what the physician brings to the table and what the dietitian brings to the table in a managed care environment such like a medical home. So I think the sky's the limit and is only bound by our imagination.
Great. Well, thank you very much for your time today. We really appreciate your insights.
Thank you, and I look forward to being part of AMCP for another 25 years.